Hi everyone, this is Anna Dolopo, and we are going to be presenting a video today on real expectations from acupuncture. I've been in practice since 99 and since 1999, and I've done 69 other videos up to date. And so today in my 70th video, I really want to explain clear expectations. Usually by the time someone comes in, they might have done some research about me. I have two websites, moveyourqi.com and committedtobetterme.com. And I've dedicated those two websites on just exactly on testimonials from my other patients. Not since 1999, but since about 2007, since I started having a website. So on both websites, you'll see a bunch of testimonials, and I believe there are 206 or more Yelp reviews. And when people see those results, people tend to think, oh, okay, I want those results, but they don't usually explain in the testimonials how many treatments are required. Many of my other videos, I'll explain this person had this issue, this is how they were suffering, this is how many treatments they had. I performed balance method acupuncture. These are the results, and this is how much they spent. And then, I also use social media, Instagram, Facebook, Twitter, and I send a lot of emails out. I use the social media platform to express when people get fast results here. But that's not always the case. People don't always heal in 5 to 7 treatments. I usually will say this person achieved this much improvement in this many treatments. So today I want to explain what are realistic expectations for something that's been a person might have been suffering from, because this is where the frustration lies with some people. Look, I have a great 85 to 95% success rate with helping people either significantly improve or graduate. Those are really great results, and I put my money where my mouth is, and I'm always referring people to my two websites, because at this phase, at almost 2 decades, I pretty much just tell people this is what to expect, and this is what to expect. This is my track record. But it's not always easily accepted to hear certain things that I share in 3 videos that I've done. That's the same topic, which is the video of accountability. This is how to hold my work accountable. The beginning phase for easy cases is those first 10 treatments. The beginning phase for more difficult chronic issues is those first 20 treatments. What prompted me to make this video is that someone texted me today, and she's been with me for 18 treatments since March 28, 2018. And she's made what I feel to be really moderate and above moderate improvements. And it's easy for people to feel improvement, but then hit a plateau and they feel like they're not getting anywhere. But I'm taking notes with every treatment, and I can see how you're progressing. So this particular patient said to me that basically that she hadn't been feeling well recently with her back and neck. She feels that she's back to 40% because she hasn't had a day in the past 2 weeks without pain, and most days it keeps her from doing her chores, and she has to take pain pills, and it's not going away. And she goes, she's honest with me, she's feeling discouraged. She doesn't know if making more, every appointment making more intense with making the treatments, if making the treatments more intense is going to help. And they drive from out of the county, from outside Orange County. So, and her ride feels, he's only seeing what, her husband's only seeing what he sees. So if she's feeling discouraged, he's feeling discouraged. So she wanted to know if making her intense sessions making the sessions more intense is going to help. And she's hearing her husband's comments, that this is taking too much time, the acupuncture, and they're spending too much money, and the pain hasn't gone away. So then today I explained that today's the 19th treatment. The beginning phase of chronic issues is the first 20 treatments. The beginning phase for easy cases is those first 10 treatments. The beginning phase for more difficult chronic issues is those first 20 treatments. So if you've had the issue for 6 or more months, or it's been very intense and acute, for 1+ month, you know, depending on, you know, the trauma that you received, you got to assume that it's gonna take time. So and it's common for pain to go up and down like this. And I usually don't prescribe herbs till 5 to 15 treatments in. I haven't prescribed herbs for this patient, and I'm going to explain why. Um, well, usually I don't prescribe herbs if I'm seeing 50+% improvement, especially regarding pain in the beginning phase, just because the acupuncture is so um, successful. And acupuncture herbs also is another it's another thing to pay. And when you do herbs, you're gonna have to take it for at least 2 to 4 weeks, if not more, like 1 to 3 months or 3 to 6 months. So I want to see that the acupuncture is doing its job. When my master, Dr. Tan, was alive, and if he was treating someone with pain, he wouldn't put them on herbs right away. I remember he would send people to me in Orange County from San Diego, and he would tell them it's too soon to try herbs. You know, the acupuncture itself is doing really well. I tend to not do herbs unless you've hit a plateau, or you know, 5 to 15 treatments in, I'm not seeing at least 30% improvement. So I said to the patient, I showed her some of the results. I took a picture, I screenshot her the first 18 treatments. I said, here are some of my notes. April 19, the right side of, let me see, her digestion was better, and she feels calm. She feels calmer. There was no pain in her digestion that whole week. And her mom also told her that she looked less bloated. She started with me March 28th. I did these notes on April 19. So I'm going to back up a little. From March 28 until today is June 7, she's had 18 treatments so far. Today will be her 19th treatment. So those were my notes on April 19. On April 24, her neck felt 30 to 40% improved. Her digestion was 40% improved. She had no more pain with eating. On May 8, she felt overall 40% better in her lower back. And overall, she felt 30 to 40% better. Her neck was 30 to 40% better. Her stress was still high. It was an 8 to a 9, and her digestion felt not 40% better. By May 17, both of her sacroiliac sides of her sacroiliac area was 60% better. The neck to the subscapular area felt 50% better. Digestion was 40% better with no more sharp pain in the abdomen. No pain when she eats. Her stress became like a 6 to a 7. By May 24 was her 16th treatment. So keep in mind, we've done 18 treatments so far. She's emailing me. She texted me today for what would be her 19th treatment tonight. On May 24, her 16th treatment, her lower back felt much better at 60%, but that day she was 50%. The right side of the neck felt better, but not as good as the lower back. And then jumping to 4 days later, May 28, it went down to 30 to 40% improvement. Healing does this. If no other practitioner has told you that, if a physical therapist, another acupuncturist, a chiropractor, or even a therapist, who's, you know, therapist is more mind, and I'm talking about physiological work, even massage therapists. I've been a massage therapist since 1996. Healing does this. It does not go like this. Sometimes it does, but for the majority of the patients out there, I would say at least 75%, it's going to go like this. And I would venture to say, if you go to any hospital and you talk to a doctor who specializes in pain, they might say the same thing. I don't know. I'm not a medical doctor, but I'm going to assume that they might even say the same thing, whether it's an orthopedic specialist or, you know, a neurologist. Healing just doesn't go like this. That's why they have to play around with the drugs, because they don't know which medication not every drug is going to affect each patient the same way. So just something to consider with that. I'm going to scroll down a little more. So that was May 28th. June 2nd, which was 5 days ago, the back and neck, the back was 60% better, the neck was 50% better. And those were some of my last, those are just a few of my notes. And then I sent her a video link to Accountability Part 3. I'll give you the synopsis of that video. The beginning phase is those first 10 treatments for easy cases. I think in that video, I only said the beginning phase is first 10 treatments. The beginning phase for chronic issues was first 20 treatments. You may not want to hear that, but that's how it is. I don't know what else to tell you. This is my 19th year in practice. I have great results. I'm not God. I can't sit here and overpromise and underdeliver. This is how I underpromise and overdeliver. Usually what I see is within 5 to 15 treatments, I want to see at least 30 to 80% improvement, at least. We're not all robots. Not everyone's going to be treated the same because not everyone is going to heal the same. Everyone heals at different paces. Genetics has a lot to do with it. Some people just have strong, healthier genes. That's it. And that's just something that I see. And some people just have, I don't know how else to put it. Some people have stronger, healthier genes. Some people have lived stronger, healthier lives. Some people just heal faster. So whatever the case is, not everyone heals at the same pace is my point. So I explained to the patient, that I'm seeing pretty moderate and good results. For 18 treatments, those are really good results. And then I asked her, how long have you been suffering? She said, I've been suffering for the last 6 years. Okay, so here's the overall synopsis. She's been suffering from back, neck, digestive, and stress issues for 6 years. And March 28th, she started to see me. It is now June 2. So April, May, not even 3 months. We're talking 2 months and a few days. She's gotten 40 to 60% improvement. She was having some really good moments, 50 to 60+%. But now we've kind of gone down to 40%. So I'm going to change things around. But just 5 days ago, she had told me that she was up to 60% improvement. So you're watching this. She suffered for 6 years. In 2 months, I've gotten 3 of the 4 issues between 40 to 60% improvement in 18 treatments. Don't you think that's pretty remarkable? I mean, I have to put this pretty clear, and as you can tell, this is a lot more intense in my video than I'm used to, that you're probably used to in my other videos, because it's more like, oh, these are results, I'm so excited, I'll share them with you. But this is it. If you go to my 2 websites, and if you see the ones where there's some testimonials that are very long, like headaches and digestive issues and pretty severe, intense pain issues, you don't realize the work that they had to put in here. You don't realize, I'm not even talking about the work I had to put into just showing up so that I can do my work. 2 months at 18 treatments, between 40 to 60, those last few weeks around 50 to 60%. That's really remarkable. And I told her, you got to give yourself some credit. And, she felt calmer. And, I want people to feel like they can turn to me and they can express their frustrations. And if I don't feel like I can heal you, I have no problem saying, you know what, I don't think this is going to work. I think that's where the rubber meets the road between me and some other practitioners, whether you're an acupuncturist or they're chiropractors or physical therapists or massage therapists or naturopaths, or I have no problem letting go of patients if I feel like it's not going to work. I treat my patients' time and money like I treat my time and money. And if I don't see progression, I don't see why I should keep you as a patient, because there's so many other great practitioners out there. And if I feel like, maybe this drug or this surgery is going to be better, I have no problem saying that. I don't have that kind of ego. I don't have that kind of, like, you got to stay with me as an acupuncturist because, I'm the end all. I don't feel that way at all. So, it's already 13 minutes. I've expressed a little bit of how this works. Synopsis. The beginning phase for early cases is first 10 treatments. The beginning phase for chronic issues, difficult issues, if your case is chronic. You got to be able to put in 20 treatments. And I know it's tough, when people find out that I don't take insurance, that this is all out of pocket, and I appreciate that. I keep my tables full. People are here to heal. And that's why I want people to know what the phases are and what to expect. These are really good expectations. She got 40 to 60% improvement in a little over 2 months in 18 treatments. Those are really good results. All right, if you want to check out more of my work, it's moveyourqi.com and committedtobetterme.com. My number is 949-305-1703. And I do phone consultations. and Skype consultations. I do consultations privately that are more in depth than just the regular consultations. So if you want information on that, contact me and I'll give you information. But I really appreciate you watching, and I hope you have a great day. Thank you.